Thank you, John, and thank you, panelists and people in the audience for being here today. I'm here to talk to you about how we can use technology to go and make a difference, especially with the difference that we have where we have limited human resources. That's the capacity of either in healthcare, but especially in education. And we have a massive need out there to go and start to address. Let me talk about that. Just give you a brief outline. I'm going to be talking a little bit about the educational reality, the reality of what our youth are facing today. I'm going to be talking about the ingredients that are intricate in creating a prevention tool. And then I'll be talking to you about how we leverage that tool with education, may touch briefly on healthcare. Today, 75% of our youth have a stronger relationship with sedentary than regular physical activity. Having some fun with this. CDC predictions are right now 40% of the people that are graduating today and the population that's in schools right now in K-12 are going to end up with a disease called late onset diabetes. That's an acquired disease. It's a disease that's acquired because of the lifestyle choices that they're given and the education that they're given, not because of the education system, but because of what happens outside the education system. We're not countering that. We're not able to counter that effectively. Over 50% of our population today, educators, are going to end up with premature cognitive impairment in the 50s and the ages of 50s and 60 years of age. Premature. A thing called prediabetes, which is hypertension, weight gain that's inappropriate for what would be expected, and also with regard to different levels of their sugar levels. 70% are facing that of the people that graduate today. This is a slide that's very dear to me. This talks about what our youth are facing today. Participation Canada has given us a report card grade of F for the inactivity that our youth are facing. Their performance in schools are being affected inappropriately because of the lack of, there's an impact on their learning ability, their learning readiness. There's an increase in our rates of depression, which is a number between 40 and 48% right now, depending on what studies you look at. And what we're seeing is that basically their self-worth, which is not depression, but their self-worth is markedly decreased in the population. Stats that we are gathering from what I have from the latest stats in 2024, or 2023, 2024, is that over 60% of our youth population are feeling undue anxiety in school right now. What does that translate into? Well, in the emergency department, I've been seeing a change, and my colleagues have been seeing quite a marked change in the mental health crisis that we're facing. We're also seeing that now we're seeing early diagnosis of diabetes and hypertension in a population we never expected to see that in the late 20s and 30s. But even worse than that is the intergenerational consequence of what's happening. That population that we're graduating today, they have a 200% increase that their youth are going to also be facing that also. Let's step that back a little bit here, though. Here's what the power that education has. If I get the slide for a projector to work. I'm going to have you go with me. I'll tell you the change. Let's talk about building solutions and building sustainable solutions that will be successful. What are the ingredients? Next slide, please. The important thing here is you need to be able to go and have the need that's necessary to be met with capacity. So you need something that can take limited resources. You can take those limited resources and be minimally disruptive to those limited resources in accomplishing what you want to do. Next slide, please. The cognitive load of any intervention, that's basically the amount of cerebral investment, the amount of thinking it has to go on. It has to be simple to implement, and also have to be frictionless. Thank you. Keep going. The bigger thing here is that the sweet spot here is that it has to be efficient and give time back to whoever's going to be administering here. Let's go on, please. The reach has to be that it has to be able to reach into the community. And if we think about this from an education perspective and a healthcare perspective, we want to reach people in the community and have an impact on families, especially in education. Thank you. The important thing here, though, is that we have an opportunity. Activity is the best learning when you get people to be regularly active, and you can start to do a 360 wraparound with regard to other health-related issues. Talking about sleeping, talking about preparedness when there's stress in people's lives. This has the opportunity, when we talk about mental health, to go and have an impact that's basically nothing else has that potential impact. Activity is the backbone of lifestyle change. Next slide, please. The wow factor here is this, is that for the first time we can have, if we have a technology set up properly, we can have a line of sight, and we can have a line of sight where we can measure the impacts of what's happening, of the impact of programs that we're implementing. The important thing about this, though, is that the effectiveness of this is that we can go and reach populations we never thought of before. Next slide, please. And the vanity factor for everybody, whether in education or in healthcare, is the vanity factors we want to be recognized for what we're doing. And that's what we're talking about, the technology we're talking about implementing here in Canada, and that we have already implemented. Please, next slide, please. So we're talking about building sustainable, scalable, and successful solutions. Next slide, please. Partners in education is this. You take the power of one individual, a wellness influencer in school. You take that one individual and you empower them where they can go and reach 300 or 400 students and only take a few minutes a week. And this is providing where you have a technology that's paired, where you have a platform that's facing the educator, and it's paired to hundreds of apps out there, whether a mobile phone, which we're not going to be using in BC, or whether it's basically the Chromebooks or a web-based product that they can go and they can document their activities each week, and the student is recognized for that. I'm going to stop the presentation here and talk to you about what the capacity is here. Is this. You have a student that for the first time can be recognized for doing small steps, recognized for activity. And that's the way you go and you get agency. If you don't have agency, if you don't give students that when they graduate, which is what over 70% of our students do not have, if they don't have agency, they are never going to be able to go. Their defined life trajectory they're facing is that they are going to be 40% are going to get diabetes, 50% are going to be facing premature cognitive impairment, and over 70% are going to be facing hypertension and other diseases. You step that back to education, and we can make the impact there if we go and we provide that form of opportunity where basically students are being recognized and where there's very low impact on our educators. Next slide, please. It's as simple as this. You have one individual, you have either an app in the hand, which again, we're likely not going to be having education, or you have a mobile, or you have a web-based product, which we have specifically developed for earlier grade schools. And for divisions 2, that's grades 4, 5, and 6 and upwards. And where you provide the opportunity where they're recognized each week for what they're doing. But even better than that, this is the kicker in the whole thing. Next slide, please. It's about that the homeroom teacher can just talk about the health and wellness piece that's the topic of the week, which is basically meets curriculum learning outcomes, but also targets the specific population of the age population so the students can be recognized for what they're doing. Next slide, please. And the wellness influencer takes care of supporting all the students. They spend 20 minutes a week to support 300 or 400 students. Next slide, please. This is what I've talked about as the kicker. We meet all the curriculum learning outcomes in Alberta, BC, and Ontario around health and wellness. We take that task off, they take that work off the teachers, what the teachers have to go and be dealing with there. We provide the blog posts, they're health expert created blog posts. This summer we have several psychologists that are working with us to go and refine them one more time. And those are deliverable in 20-week slots where students are educated about everything that they need to know so they have that in their backpack when they leave school. Next slide, please. Let's talk about whether this works or not. Next slide, please. 1,000 students, 3 teachers, 20 minutes a week. They increase the activity of that student population by 150,000 minutes of activity every week. 150,000 minutes of activity every week. But this is the secret. This is the lightning rod of what took place. When parents were coming to PT days, they were talking about, for the first time in their life, in the younger generation, in the younger age groups, they were being active with their students at home. We were changing what was happening in the home, that social environment around the child. And parents were getting these blog posts each week of different things that they might know, but brought to their attention at school, that for the school, that was a priority for them. Next slide, please. Let's look at what one teacher did. They supported, we don't use the word track because nobody wants to be hunted here. They supported 400 students, and they were supporting them between 40 and 60,000 minutes a week, one individual. That's what the capacity is here. Next slide, please. Where are we going? This fall, we're launching, after doing a fair bit of work the last 38 weeks, we've been working with 2 different school districts. I'm embedded as a physician, the first embedded physician in a school district in North America, fully embedded Calgary Catholic. And my mandate is that 50% of my mandate is that we have to make the most active and healthy school district in North America. I've got 2 years to get there, and we're well on the way there. This is a school district that's empowered and is powerful to work with.
I want to see a protest from our
okay.
school trustees here. Does West Bay want to challenge them?
I'm willing to work with you folks. Okay. We're going to be working with 61,000 students and 120 schools and 5,500 employees. Each of these requires something different. Schools, you think schools are, students are there and the employees there. They're all different ways of approaching things, and we've looked at how to approach them. We're also looking at a smaller urban rural school district with 11,000 students, 22 schools, and 1,500 employees. Where we're going is that we're looking at working with another organization in Ontario to bring on 250,000 students this next year, and by the end of 2025, I should say. And we're interested in working with BC and with and CHFI and us are basically, this is the population we're targeting. We've got 4.6 million students up there, and 75 to 80% of the population are not active enough right now to sustain their health because they're more sedentary and rarely physically active. And we're here to do something about that. Thank you for your time.